Welcome to part 3 of the Neuromuscular Disorders lecture series. We're going to talk about infant botulism. The picture on the front is the actual organism that once it's ingested releases a toxin that affects the nervous system. Although less than 200 cases are reported per year in the United States, 65% of them involve infants. If we can catch it early enough, which is before the paralysis is complete, and we administer the antitoxin, then we reduce the death rate. And our current death rate for botulism is about 3 to 5%. So the Clostridium botulinum produces spores, and they replicate in food, in dirt, and in dust. We have a recommendation to not give infants honey because honey has a lot of these type of spores. Improperly canned foods can also be a source. Because it's found in dirt and dust, and babies are putting everything in their mouth and they're crawling around outside as well as inside, that increases their risk of contracting botulism. They have less tolerance for the toxin than older kids. Once a kid hits 1 and they eat honey and there are botulism spores in the honey, they actually do just fine. So what this spore does is it goes into the intestine and eventually works its way to the neuromuscular junction, and it blocks transmission across the synapses. Therefore, the muscles become weak and eventually become paralyzed. So typically, it starts in the head. And so their face is going to have no expression, and then it rapidly, within 36 hours, spreads all the way to the toes. And the risk, of course, is respiratory failure. So symptoms can be at the most 36 hours, but it can actually onset at 12 hours. So the diagnostics, we can look at the feces and we will see that the toxin is present. But in the interim, we have a kid who's brought in who is becoming more and more flaccid. There's a lot of other things that can cause that, but in an infant, this is what we're going to be looking for on their radar. Constipation may be the first sign, but really that's halfway down the body when you think about it. So really they're going to have weakness. When the doctors do their physical assessment and they tap their tendons, reflexes, they're going to be diminished. They have poor head control, which you can see this little baby that this kid is sleeping very nicely, but he is just totally relaxed. Their face has no expression, and they do have ptosis, similar to what you see with myasthenia gravis, but they are not a candidate for that. They're far too young. And then progressively they get weaker. They don't have a gag reflex. They're not handling their secretions, but they're not sick either. This isn't a febrile illness. They don't have that facies of, wow, I have a really bad illness. And the interesting thing about their respiratory failure is they're not going to tell you they're having a hard time breathing. They just quit. So they're not going to have the nasal flaring. They're not going to have retractions. They won't even have adventitious breath sounds. And of course, because they have poor respiratory effort, they end up retaining their carbon dioxide. They become acidotic and hypoxic. And all we need to do is intubate them. This is what a hypotonic baby is going to look like. And here's a real baby that has hypotonia. What do we do for these babies? Respiratory support. So they'll need a temporary trach because it takes weeks to months for them to recover. So we'll initially just do an endotracheal intubation, monitor their O2 sats, we'll get ABGs, make sure that all of our gases are where they need to be, we'll suction as needed. Now the medication that we can give, and we need to give this as soon as possible, and in our state, California actually has its own supply of the botulism antitoxin heptavalent, and it covers all 7 types of botulism. We want to try and give it within 24 hours of symptoms, and this is administered as a slow IV infusion. The infants receive 10% of the recommended adult dose. That's basically all you need to know. You're not going to be prescribing it, but what you're going to be doing is you're going to be giving it slow IV. We want to avoid giving the aminoglycosides, gentamicin, tobramycin, because that increases the effect of the toxin within the body. And we don't need any other antibiotics for this because the botulism releases a toxin, not a bacteria. We will provide nutritional support initially with an NG tube or an NJ tube, and depending how quickly the child responds, if it looks like we're going to have this kid for months, then we're going to go ahead and put in a G tube. Occupational therapy and physical therapy will be needed because as they regain their muscle activity, then physical therapy needs to strengthen them, and we don't want any contractures and all that other stuff that goes along with immobility. OT will work with the child to get them to suck again because they have forgotten how to do the suck, swallow, and breathe. Another interesting thing about botulism is there's nothing wrong with the brain. It's very scary. I've only seen one case of it. It was not in an infant. It was in a teenager. And the only thing this kid could do was move his eyeballs, period. And he was like that for 8 months. And so that's what this infant will be like also. Scared to death, we still want to promote the developmental milestones that's going on in the brain. So musics, mobiles, videos, and provide family support. The biggest thing that we can do as nurses is related to prevention. No honey until after the child is 1 year of age. And then for those who like to can their own foods, they need to do it properly. Other things that we will do for this child, because they're going to be in ICU for almost the entire time that they're admitted to the hospital until this kid can sit up, can swallow, can breathe on their own. Elevate the head of the bed, keep them on a rigid mattress, put little towels on the side of their head so that their head and their chin doesn't roll into their chest and they're not always on the side, and position their feet, put another towel under their feet so that they're bent so they don't develop foot drop. Of course, skin care is very important. And so this is a picture of a baby who has botulism who is elevated. So see how we're going to do that cervical support on the right? And that's just to maintain their alignment. And then last, here is a picture of a baby who actually had botulism. And so apparently this child could breathe on her own, but the whole rest of her body is very flaccid and there's no head support. And after she was treated, there she is, up and around being normal. So this ends the lecture on botulism.